So how can aerobic exercise help prevent migraine or migraine attacks? So hello, I'm Dr. Sam Kalakidis, and I'm a physical therapist that specializes in the treatment of migraine and headache disorders. So did you know that aerobic exercise is one of the most effective non-pharmacological strategies to help improve migraine frequency? So today I want to share with you a little bit of the evidence-based guidelines on how much exercise you actually need and give you practical tips on how to get started. So why aerobic exercise? Aerobic exercise has been shown in the research to decrease migraine frequency, intensity, and duration while also improving somebody's quality of life and decreasing the levels of disability. So according to our recently published clinical guidelines, the most recommended one is moderate intensity continuous aerobic exercise, though low intensity and high intensity exercise are also okay. But but moderate intensity is the best approach for migraine management because it's the most studied aside from yoga. So it got a grade in this study of a B recommendation, so it can probably change migraine frequency. So the question is, how much exercise do you actually need then? So with this guideline, the duration recommended were 30 to 40 minutes a session for 3 to 4 times per week. And the intensity, again, moderate, which means working hard enough to raise your heart rate and breath, but still be able to hold a conversation. So this would roughly be like 64 to 76% of your maximum heart rate, or a 12 to 16 on a rate of perceived exertion scale that goes from 1 to 20. An important thing to note about these guidelines is that they are actually less than the American College of Sports Medicine guidelines for activity for an adult for health and wellness. I think this is important because it shows that even small increases in physical activity can help improve migraine for those with it. Also, please remember that consistency is really key here. Regular exercise over weeks to months is where the real benefits happen. And to maintain these benefits, exercise needs to become a lifelong habit for better migraine management. So how do you get started? Starting an exercise routine can really feel overwhelming, and it is a lot for a lot of my patients, especially if you're worried about triggering migraine attacks. So here's some manageable steps that people can start. So one is set clear goals. Ask yourself what you'd like to achieve with exercise. Is it just better health? Would you like just to walk 30 minutes 3 times a week? Do you want to run a 5K? Over time, you can then measure this and see progress and then add on to it depending on how you feel. Step 2 is find the right starting point. So if your goal is to run a 5K, we don't start on day 1 running a 5K. You need to build up to that. So if you're currently inactive, beginning with just 10 to 15 minutes of low intensity exercise like walking or cycling and gradually increasing the duration and intensity over time can be really helpful. A progression should really be slow and allow the body to make the physiological adaptations to handle higher levels of physical activity so you don't trigger migraine attacks. So this would mean like increasing no more than 5 to 10% of the volume of exercise each week. The third thing I tell people is to, again, prioritize consistency. Schedule exercise like any other task, like sleep or eating. Treat it as a non-negotiable and put it in your calendar. And I like that this really needs to become a regular, sustainable habit. And then 4 is know your body. During a migraine attack, exercise isn't ideal, but sometimes for some people, gentle movement like walking can be helpful. But always listen to your body and make adjustments as needed. It's okay to stop a workout early if you feel like it's going to trigger an attack, or do less time or distance of a walk if you think that doing too much might trigger an attack. It's okay to modify. And then the last thing is monitor your progress. Track your migraine symptoms alongside your exercise routine. This can help identify patterns and help you refine your exercise approach. This might mean creating a journal if necessary so that you can determine if there's exercise-related triggers so that you can work with your neurologist or your physical therapist to problem solve that trigger and work around it. So remember, aerobic exercise is a powerful tool for managing migraine, but starting small and staying consistent and building gradually can be really the key to success here. So it's just 30 to 40 minutes 3 or 4 times a week. Migraine and frequency can decrease and improve your overall health. Thank you for watching.